think sometimes genetic testing can be seen as a scary thing of what will the results be, but in my experience it's been a blessing to many patients because they found out about diagnoses that they wouldn't have known about otherwise and have been able to undergo treatments or procedures that have significantly reduced their risk of developing certain cancers. It's important to identify patients who might be at an increased risk of cancer because there are things that we can do within the realm of medicine to either monitor these patients more closely or to administer prophylactic treatments or surgeries to help reduce the risk of cancer development.
The Ambry Care platform provides a lot of information to our providers and our patients. It makes it easy for patients to give us the information that we need to help them in making the best healthcare decisions. Prior to the implementation of the Care platform, we actually would identify patients who were good candidates for genetic testing and work with them. We had to send them to an off-site location where they would have another appointment that they would have to get the genetic testing done, and then they would have to go back and get the results. Implementing it within our clinic made it a seamless process for our patients as well and allowed us to become more of a one-stop shop. So patients came in for their appointment with us. If they were candidates for genetic testing and if they were interested in it, we could do it right there that day.
We had a patient that came into the high-risk breast clinic due to an elevated risk score. She ended up being eligible for genetic testing and came back with a mutation. Her daughter came in for free family testing and also tested positive, and the gene that they tested positive for had an increased risk of a rare type of ovarian cancer that comes in children. So she actually had a young girl that went on to get genetic testing as a pediatric patient to potentially prevent her from getting ovarian cancer. I do think having access to genetic counseling through the CARE program has been really helpful. I'm not a certified genetic counselor, so I really like that the patients are able to have that conversation with somebody who's been trained to do that. And then the way we set it up is the patients come back in to see me after they've had the counseling, so they've had time to think about the results and what they want to do, and so we do have a more meaningful discussion when they come back after they've had the counseling.
For providers who are considering implementing this in their practice, I would say that my experience with it has been excellent. This program is very easy for patients to use, and it's very provider friendly as well.
Other healthcare providers, if they're on the fence about implementing genetic testing, I would tell them to do it and work with the Ambry team. They made it super easy. For us, they were constantly on site helping our team with the implementation process. They were with us every step of the way, and it's the best thing that we can do for our patients.